On this Mindful Monday, we're celebrating American Heart Month, which takes place every February. It's an especially important month to raise awareness for the leading cause of death for men, women, and people of most racial and ethnic groups in the U.S. Today, we are joined by Dr. Qasim Raza, cardiologist at Mayo Clinic System in La Crosse. Good morning, doctor. Thank you for being with us.
Thank you for having me.
Good to see you. So every year, about 805,000 people in the U.S. have a heart attack. Of these, 605,000 are a first heart attack. So what are the signs some people should look out for that they may be having a heart attack?
Great question. So the first thing that you'll expect a person having a heart attack is that there's a sensation of a crushing chest pain. And this is in fact so popular that it's been described as a sign. It's called Levine sign. What that means is that the patient comes standing like this. So the impact of essentially having crushing chest pain, which is either static or most likely radiating to your shoulder, to the neck, to the jaw, this is one key feature that you should anticipate if you're having a heart attack. The next thing that you can experience is you may be sweating, you may have a sense of impending doom. These are all things which you can have. You can have shortness of breath, and these are the telltale signs that you may be experiencing something which is not something that you should be working on at home or trying to fix at home. Right,
so if you do start experiencing this, what should you do?
If you are experiencing these symptoms, the first thing you should do is call 911, because many times people will think that they'll try to work on this at home, they'll try to take some home remedies, or they'll even call a loved one, they'll have some friends or family members try to take them to the hospital. All of this is incorrect. What you need to do is call 911 because number one, this is time sensitive. We say time is muscle. Every minute that you lose getting to the hospital, you're losing fibers of muscle in the heart. So call 911, get the ambulance there, it'll get you to the hospital fastest. And they can do an EKG while they're en route to the hospital, which helps facilitate the diagnosis.
Okay, and so heart attacks obviously happen for a number of reasons, but what are some of the biggest factors behind what's causing these?
Absolutely. So anything which causes heart disease can cause a heart attack eventually. And it's important to distinguish between these two entities. Heart disease is basically blockages which are developing in the vessels of the heart. Now they may develop over time, but may not necessarily cause you symptoms. But if that blockage, which has a lining on top of it, if that blockage ruptures, it causes an acute blockage in flow downstream of the vessel. Now what that means is that the muscle of the heart is not getting oxygen, is not getting blood supply, which is why you're having this heart attack. Now, the reasons you will have this can be if you have high cholesterol issues, if you have high blood pressure issues which are untreated, smoking, stress or a stressful lifestyle, dietary habits, sedentary lifestyle, all of that adds up to having heart disease, which can then eventually cause a heart attack. Diabetes is another one.
And what are some things that we can do to keep our hearts healthy to prevent this?
So go backwards from all the risk factors that I listed and work on each of them one by one. If you have high cholesterol, number one, get diagnosed early. Number two, treat it adequately. If you have high blood pressure, don't skip your meds. Don't think that you can just use lifestyle modifications. If you're on 3 medications, you're going to hold off on the 3 pills and just work on lifestyle to help your blood pressure. No, it's a point where your body is asking for help, so you need to give it some supplements. So control your blood pressure, control your cholesterol, control your diet. You have to incorporate weight loss regimes in your lifestyle. If you have a stressful job, you have to consider this is taking a toll on your lifestyle and your heart. So try to consider getting into something which is less stressful. It's easy. It's not as easy to do, but it's one of the things you have to consider. If you have diabetes, you absolutely must have good diabetes control, because one of the things that the diabetes can do is not let you feel the symptoms of a heart attack.
Oh, wow. Okay. All right. Well, doctor, thank you so much. Some great tips there.
Absolutely. My pleasure.
Yes. And stay with us. We will be right back.